Let's see the next topic in general science, that is human circulatory system in biology. But before proceeding, you should know the important types of questions which are asked in this chapter. Okay, so these are the important types which are generally asked in the exam. And out of these, the most important one is the structure of heart and the facts about arteries, veins, capillary, and the largest, smallest, and longest blood vessels. Okay, so the first question is on your screen. It says how many number of chambers are there in human heart. Okay, I repeat once again, how many number of chambers are there in human heart. Okay, a very simple one, a very factual one, and all of us knows that human heart have 4 chambers. Okay, so those who have given option C, well and good. What about the other options? So let's see. So 2 chamber heart is found in fishes. Okay, and whereas if you talk about 3 chamber heart, it is found in amphibians. Okay, amphibians. And 5 chamber heart is not found in any of the animals. Okay, so the answer for this option is option C. And similar pointer we have seen in our theory class that a human circulatory system basically transport system of the body, and its main function is to transport oxygen, nutrients, hormones, and the waste products. And the component of human circulatory systems are basically 3. The first one is blood, that we are going to take in a separate session. The second one is heart, and the third one is a blood vessel. Okay, and we have seen all such pointers in our theory class. Okay, I'm not going to repeat in today's session. You can just note it down, all these pointers. Okay. The next question says, what aids in preventing the mixing of oxygen rich and carbon dioxide rich blood in the heart? Option A, the wall between the chambers, pulmonary wall, tricuspid wall, and aortic wall. Student, it is the wall between the chamber, between the left chamber and the right chamber, which is also known as septum. SEPTUM, which basically prevent mixing of the blood between these 2 chambers which contain oxygen and carbon dioxide. Okay, so those who have given option A, they are right. And this we have seen in our theory class that this is the structure of heart. It has basically 4 chambers: left atrium, right atrium, left ventricle, and the right ventricle. Okay, and it is covered by a double layered membrane that is called pericardium. Okay, so this is pericardium, and there are 3 walls, and the septum is basically the wall. As you can see, this is the wall, and this contain the carbon dioxide rich blood, whereas this side, the left side, contain the oxygen rich blood. Okay, and sometime he can ask you about the sound produced during the closing and opening of valves. So if you see these are the valves, and if they are closed and open, so lup dub sound is created. Okay, all such pointers we have seen detail in the theory class. Yes. The next question, the blood vessel that carry blood from heart to the various parts of body are called what? Okay, heart to the various parts. Yes, it is arteries. So there are 3 types of blood vessels: arteries, capillaries, and veins. Septum, as I told you, it is the chamber wall between the left and right chambers. Okay, so these are basically the blood vessel, and you can eliminate option C. So in these 3 arteries, it is arteries, are the blood vessels which carry blood from heart to various parts of body. Okay, and the main difference between arteries and veins is that they carry blood away from the heart. Okay, so basically these arteries carry oxygen blood. Okay, except one exception is there, it is pulmonary artery which only carry the carbon dioxide. Okay, and these arteries have no valves, whereas veins have the valves. Okay, and opposite to that, the veins basically carry the deoxygenated blood except the pulmonary vein. Okay, and this goes toward a heart. Why they are going towards heart? Because they are deoxygenated blood, means it carry carbon dioxide. So in order to expel through the body, through lungs, these are carried by the veins. Okay, the other one is the blood capillaries, which is basically the small vessel where exchange of gases and nutrient occurs. Okay, so in exam, if he asks you about the smallest blood vessel diameter wise, it is the capillary, and the largest blood vessel, it is the aorta. Okay, aorta is the largest blood vessel. It carry oxygenated blood and it is going to be spread throughout the body from the heart. Okay, the smallest blood vessel is called what? Okay, so the smallest, largest, longest, all these are important topics in this chapter. Okay, and just now I told you the smallest blood vessels are the capillaries. Capillaries are the smallest blood vessels. Okay, so those who have given option B, they are right. Let's see the next question. Which of the following is the longest vein? Okay, which of the following is the longest vein? Hepatic vein, saphenous vein, pulmonary vein, and vena cava. Okay, he is talking about the longest vein, not the largest vein, so don't confuse in that. Okay, so the longest vein is the saphenous vein, which is normally found in the leg basically. Okay, so saphenous vein, those who have given the answer, they are right. And these are other important arteries and veins which are commonly asked in the exam. The first one, as I told you, that arteries carry oxygenated blood, whereas veins carry deoxygenated blood, or in other word, you can say they carry carbon dioxide, and this oxygenated blood means they carry more oxygen. Okay, and in the pulmonary artery is the special artery which carry the deoxygenated blood. Basically this is an exception, so this is very important. Similarly, on the opposite side, it is pulmonary vein which carry oxygenated blood. Okay, normally vein carry deoxygenated blood, but this pulmonary vein carry oxygenated blood. Okay, the next one is the aorta. Why it is important? Because it is the largest and the longest artery. Okay, and even it is the longest blood vessel. And other one which are important from the exam point of view are coronary artery, hepatic artery, and the renal artery. The artery which goes to the heart, that is called coronary artery. The artery which goes to the liver, it is hepatic artery. And the last one, renal artery, which is going to the kidney. As the word renal itself suggests that it is going to kidney. Okay, what about important veins? The second one is the vena cava. Okay, vena cava is the largest vein. It is not the longest. Longest one is saphenous vein. The largest one, largest in the terms of diameter wise. Okay, it is vena cava. So there are two type of vena cava: superior vena cava and the inferior vena cava. Okay, and the saphenous vein is the longest vein lengthwise, and hepatic vein and the varicose vein, which are swollen bluish vein, if you find, it is varicose vein. Okay, so these are the important arteries and veins that we have seen in our theory class. Okay, so I have revised these veins and arteries. Okay, Next question. Systolic blood pressure is exerted by blood against the wall of the arteries during which of the following phase? Okay, so as you know, the blood pressure contain two activities, basically systolic and diastolic. Okay, basically the blood which is passing through the arteries and veins, they carry some pressure. Okay, so there are two type of pressure. I will first show you the difference. There are two type of blood pressure, systolic and diastolic. Okay, since heart is a pumping organ, so pressure will be created. So when pressure is created during the contraction of heart, so when you are contracting something, what happens? If you have a balloon and if you are trying to press it, what will happen? The blood will leave out of the ventricles. Ventricles, as I told you, these are the chambers in the heart. Okay, so when contraction of heart is there, it is going to leave the blood. Okay, and it is a maximum pressure which occurred during the one heartbeat, and it is 122 mm of mercury. Similarly, diastole is the opposite. When you have pressed the heart, that is contraction of heart, and if you release that thing, means your relaxation of heart is happening after the contraction. It is a minimum pressure which is going to happen during the one heartbeat, and it is 80 mm of mercury. Okay, so the normal blood pressure is 170-180 mm of mercury. With respect to atmospheric pressure, you should remember 120 is the upper one, which is called systolic, 80 is the diastolic. Okay, and the instrument which is used to measure pressure is called sphygmomanometer. Okay, sphygmomanometer. Okay, so blood pressure is very important, and one other pointer you should know, that it measures the pressure on the wall of arteries, not the veins. Okay, so blood pressure, the normal blood pressure, the difference between systolic and diastolic, these are the important pointers. Coming back to the question, so it is ventricular contraction is the systolic, whereas ventricular relaxation, it is diastolic. Okay, so option A is the right answer. The blood pressure in our body is lesser than atmospheric pressure, greater than atmospheric pressure, equal to atmospheric pressure, and none of the above. Yes, so the blood pressure of our human body, as I told you, it is 122/80 mm of mercury, and this is reference to the atmospheric pressure, that is 760 mm of mercury. Okay, so when you have this reference, the upper one is 80, so it is basically greater than this 760. Okay, it will be the greater than the atmospheric pressure, because your reference is this one. Okay, if you take it as 0, with respect to 0, you are having 120 of mm of mercury, so it is greater than atmospheric pressure. Okay, let's see the next question. Sphygmomanometer measure the blood pressure in which of the following? Veins, arteries, eye, synovial. Yes, it is the arteries. Okay, sphygmometer measure the blood pressure in the arteries. Okay, the first heart plant was performed by which? Okay, this is a factual question, and if you know GK and GS very well, you can answer this question. It is option D, Dr. Christian Barnard. He is the doctor from South Africa who successfully carried out the first heart transplant. And the other facts about this heart transplant, it is that the patient name is Louis Vansky, and it happened in year 1967, and the place was Cape Town, South Africa. Another fact related pointer, Jarvik 7 is the first artificial heart, and John Hop invented the pacemaker. Okay, so these are another factual based pointers. The pacemaker is also known as what? Next level question. SA node, AV node, bundle of his, chordata, tensei. Yes, it is SA nodes, sinoatrial node. Okay, SA node are also known as pacemaker. Okay, and the word itself suggests that pacemaker is something which is going to control the pace. Pace is what? To control the rhythm of the heartbeat. How it is going to control the rhythm? By producing electrical pulses. Okay, so the natural pacemaker which is in our heart, it is SA node, sinoatrial node, and it is located in the right atrium near superior vena cava. Whereas if you talk about artificial pacemaker, which is device implanted on the heart when heartbeat is irregular. Okay, and John Hop invented the pacemaker. The last question for today's session: which of the typical signs of the heart attack? Nausea, severe perspiration, headache, severe chest pain. Yes, nausea is one symptom, severe perspiration is another symptom of heart attack, and severe chest pain. So option 1, 2, 4, option D is the right answer. Headache is not a symptom of heart attack, right? So there are few other heart related disorders. The first one is hypertension. When you have high BP, high blood pressure, means if the person is having more than 120 mm of Hg, the systolic blood pressure. Hypotension, when you have low blood pressure. Tachycardia means when you have faster heart rate, more than 100 beats per minute. And coronary artery disease, when the coronary artery which is going to the heart, it become narrow. Okay, why it become narrow? Because of the fat deposition. And heart attack, it is sudden stopping of the heart function. Okay,